And now it's time for us to delve into Good Living segment. On Good Living segment, we do our very best to talk about sicknesses, diseases, our health, how best we can control these when we encounter them, or how best we can live with people who are going through certain malfunctions in their bodies and all that. And so this conversation is for every single person. Now, for today's topic for Good Living segment, we are talking about sickle cell anemia. Sickle cell anemia is a topic for discussion, so make sure that you get interactive with us on our social media platforms. It is Joy Prime on Facebook without a TV. It's just Joy Prime. So start sending in your questions in our comment section, and I'll definitely read them or ask our guests for the show today. And so my guests this morning are Rosalind K. Amo, who is a mother of a sickle cell patient, and Dr. Sheila Asamoah Ochre, who is a pediatrician, a sickle cell clinic, 37 Military Hospital. Good morning, ladies.
Good morning.
How are you doing?
Very well, thank you.
All right. And so, viewers, like I mentioned earlier, it's time for us to get interactive. So start sending in your questions in relation to sickle cell anemia. The one thing that I read about sickle cell anemia is that it is a public health burden here in Ghana, and that it is indicated that, or studies have shown that about 2% newborns have sickle cell anemia, which is sad. But the main question here is, how is that even possible? What is sickle cell anemia? How are children born with sickle cell anemia? Let me start with you, Doc.
Okay, that's true. Sickle cell is indeed a global burden. And sickle cell anemia is most common in African countries.
Okay.
People of the Mediterranean descent. And it is a genetic disease. When I say it is a genetic disease, I mean it is inherited. You have to inherit an abnormal hemoglobin from each parent to become a sickle cell patient. So by way of definition, I would say that sickle cell disease is a genetic disorder in which an individual inherits two abnormal hemoglobins from each parent, and the patient starts exhibiting the signs and symptoms of the disease. So a parent has to have one abnormal, the normal hemoglobin is AA.
Okay.
And sickle cell disease, there are over 800 variants of sickle cell disease. And so if a patient or someone does not inherit an A hemoglobin from a parent, but inherit any of these abnormal hemoglobins, then it leads to sickle cell disease.
Okay.
So you can have, as I said, over 800 variants, but the most common ones are, you can have SS genotype, you can have an SC genotype, you can have S-beta zero thal, S-beta plus thal, S-alpha beta thal. Those are the common ones, but that is the way it is inherited. So you have to get one S from a parent, a C from a parent, then it comes together to be sickle cell.
So even the parents carrying these, carrying the sickle cell, they also got it from their parents, possibly.
Yes.
It's not like a lifestyle that causes this career. It has nothing to do with, it's genetics.
It's genetics. It is inherited. And the parents should be carriers of the abnormal hemoglobin. So the parents need not be sickle cell patient, but once they have an abnormal hemoglobin, be it an S, a C, a beta thal, they can pass it on to their children to get sickle cell disease.
And that is how children or people in general get sickle cell disease.
Sickle cell, yes.
Okay. Now let me come to you, Rosalind. Hope you're okay.
Very well.
Very well.
I'm very
the way you were quiet, you were just...
I was just consuming what doctor was telling us. I mean, you learn a new thing every day.
Right.
We know the common ones, but we didn't know the over 800 type.
Oh.
So this is also a new information for me.
How old is your child?
He just turned 14 on Thursday.
14. When exactly did you find out?
When he was 4 months.
4 months. How?
Yes. To start with, I have a family on my paternal side, we have quite a history with sickle cell.
Oh, okay.
My paternal grandmother was a sickle cell patient, but at that time, we didn't know. I mean, in those times, in the 50s, 40s, 30s and 40s, it was attributed to something else, and she died quite early. Unfortunately, my older sister, the one I come directly after, she had a second child who was diagnosed as having sickle cell. We lost her when she was 10 years. And so we were very cautious. It was later when we had those honest conversations that we got to know that our father was a strong AS carrier. And unfortunately, he passed it on to almost all. He has 7 daughters, to all the daughters. And so we were very careful not to have children. But at the time I got married, the conversation was not always on the table. I told myself I didn't want to marry somebody who had anything to do with sickle.
But you were aware before you got married?
I was. And I asked my husband, then we were dating, I asked him and he casually said, oh, he thinks he's okay. He was O positive, he was okay. So you had assumed that he was okay.
That is an issue.
Yes.
That is an issue.
So I had 2 older children.
Okay.
And they were both AA. My daughter is here with me. She's AA. My son was also AA. So we assumed that we were okay. Until the 3rd one came. And we had to go through the routine tests and everything. I mean, you go for antenatal and then they will tell you that, oh, you need to run, or a pediatric section and they'll tell you, we need to run a few tests. So I remember when the results came, they said he was positive. And then the doctor said, look, we need to do the electrophoresis to know what exactly it is. And what is your genotype? That was when
But you know, what I'm actually interested in, at the time, you being aware that your grandfather was a carrier of sickle cell, and you were dating, although you asked your husband, and your husband said, oh, because I'm O positive, so I don't think I'm a carrier or something like that. Had you personally tested?
I knew I was AS.
Okay.
I knew I was AS. And so for me, anybody with a C or S, I mean, the common ones that I knew was the C and S. So if you came and we're having a chat and I'll ask you, so what is your genotype? And you said AS. I said, look, we can be friends. I don't want, or AC, because that was the only way you would bring a child. And there's always a 50-50 chance of having a child with sickle cell if you marry somebody who also has a deformed hemoglobin. And so I was very cautious not to create a child with that burden, because it's not easy living or managing a child with that condition. Thankfully today, because of medicine and people like Dr. Asamoah, life is a bit easier, but it's very tough, very tough. And you don't want to put anybody through that kind of hell. And so when I was told that he was, and then the doctor said, we will quickly run the electrophoresis. So he called the lab people. They came and took the sample at his office, consulting room, and then he said, we are waiting for the results. So it's urgent. They brought it, and then when he came in, I remember that day, I was with him alone in the room, and then he said, oh, unfortunately, not the kind of news that you are looking for. He is SS. And he was just on my lap. I cried for 30 minutes. I think that's the day.
It was just 4 months.
The doctor didn't continue with his pediatric clinic for the day, because I cried for a whole lot. And then suddenly, then I said, okay, maybe there's a reason why God made him, because the older ones are not. And then I asked him, what do we do now? And that was when we started the management of him. I mean, his first 4 years was very difficult.
Hold on, we'll definitely come to that. But Doc,
let me just add something to what she is saying. So a lot of people just know of the S and the C genotype.
Okay.
And a lot of people don't know their genotype at all. And usually these days, during the premarital, counseling, they do the Sickling test. Unfortunately, the Sickling test only picks up the S. It doesn't pick up the other genotypes.
Okay.
So somebody who is AC, somebody who is A-thal, A-beta plus thal will go and do a Sickling test premaritally and say that I am negative, because it doesn't pick up the S genotype. So what we advise people to do, to request for, is the HB electrophoresis. The HB electrophoresis will actually tell you what your genotype is, whether you have a C, whether you have a beta thal, whether you have an alpha beta thal or an S. So all that people know is just an S genotype. And just as he said, it is inherited. So if you have both parents, the probability of having a sickle cell patient with each pregnancy is 25%. And having a child who is a carrier is 50%.
So in Rosalind's case, she being AS, there was a high possibility that her husband was AS as well. Yes. Although he says he was O positive, because you see, it's one thing that I hear people say a lot. Yeah. Oh, because I'm O positive, I'm not a carrier of sickle cell.
Negative.
Yes, or O negative. I'm not a carrier of sickle cell. No, please help people out there really understand this.
So there's a difference between blood grouping and then genotype. Blood grouping has got nothing to do with sickling. Blood grouping, you have 4 different types of blood group. You are either O, AB, a B positive, or what. But the sickling or the HB electrophoresis tells you what your actual genotype is. And that is different from having a blood group. Okay. So you are either an AA is the normal one, the normal hemoglobin is A. You are either an AS, which that you're a carrier, an SS, a sickle cell, SC, S beta thal. So apart from just checking our blood group, we should also check our genotype so that it will inform our decision. Because just as she said, it's not really worth it to have a child who is sickle cell patient. Right. Though the advances in treatment, we are helping them, but it is avoidable. Okay. You don't have to go through that stress because it is both emotionally, financially, spiritually, so stressful. Yeah. And the love that you started with first, in terms of marriage, you're so much in love. Let the first sickle cell child come. Let the second one come. Let the third one come. If you don't take care, the marriage will break and the love will vanish. It will vanish. Because the financial stress, the emotional, the psychological, the spiritual is so difficult.
Rosalind, has that been the case with you?
It's been emotionally, it's not been an easy ride.
Right.
We only say that we live on our faith, and sometimes you want to say that he's a miracle baby. Everybody around him has gone through that. I mean, has suffered some of the emotional stress.
Can you speak up for me?
The emotional stress. By 6 months, he had already started showing the signs of having sickle cell. He was a very healthy, big baby.
What were they?
And it started with the normal joints, the pains, the crisis. But because he couldn't talk, we didn't know. But you would observe and know that he had slowed down because he was a bubbly boy who would move around. So he was crawling. And then on days when you put him down, he doesn't want to move. So that is when we got to know that he has it. And then he would come up with a temperature. So we went to the hospital, and that was when they said it. So they started managing the pain. But the truth of the matter is they only help you to manage the pain. The pain doesn't go away. And the baby can't tell you that I'm in pain. So you would have to observe to know it. And if you're not careful, to have somebody who also doesn't understand and thinks that the baby is refusing to do certain things because you put him down and he's clinging to you. He doesn't want to sit and all that. We managed that. And then by the second birthday, we had the issue of having the HB dropping every time, having the lowest level of HB. Sometimes we will be playing around like that, and then the next moment you realize that he has become slowed down, and you realize that his eyes are paling and everything. You go to the hospital. Thankfully, I have friends who are doctors, and we had begun reading about it, so it was easy. So you just rush him to the hospital, and they'll tell you that, oh, his HB is low, so we need to transfuse. And then they will have to look for blood and give him the blood transfusion. As soon as the transfusion is done, he's back to his normal self. And then by age 3, we realized that he had started having a stout growth. The spleen was becoming bigger. And so because we were going for our regular sickle cell clinics, they realized and he was diagnosed of having a malfunctional spleen. So what it meant was that the spleen was storing all the blood and was not recirculating the blood.
Okay.
And so by age 4, he had undergone splenectomy and they had taken off the spleen. We thought that that was it. I mean, once the spleen had been removed, life was back to normal. But after the splenectomy, we started having the crisis, I mean, very severe ones with the swelling arms and joints and all that. So sometimes we always said we had an unwritten this thing. The third week of every month, we had to prepare to go to hospital for admission. And so at the back of my car, I would always pack a bag for ready for admission.
Admission, yeah.
So that as soon as it happens, and you don't know where it would happen.
Exactly.
I mean, I remember one time a friend was having a birthday party for the child, and so we all went for the party. He was dancing and everything, and then after a few minutes, he just came to me and sat by me. Ma, can we go home? And I said, why? I think the pain is coming back. And that was it. So until you understand him, until you know what he goes through. But what it means is that the other people suffer, especially for those who can't, who can't afford seeing him in pain. His grandparents, so my maternal, my mother and his paternal grandmothers were two people who wouldn't want to see him in pain. I remember they had gone to visit him here in Kumasi for her 90th birthday. The whole family, wherever they were, had gathered, and I just said, okay, so you can take him along as well. The day before the party, he had a crisis, and he was on admission. It meant that everybody yes, so that is it. For us, I mean, we are grateful that every time it has happened, we have what it takes to be able to take him to the hospital. But I have also come to learn by my association with other parents that about 70% of the parents don't have what it takes.
Yeah.
They don't have the money. They don't have the emotional strength to be able to do that. Because sometimes when the child is in pain, you are helpless. You can't do anything for the child. You take him to the hospital. They would put him on the medication and everything. And you have to only sit down by the child and watch the child go through the pain. And then you ask yourself, you start blaming yourself. It's all my fault that he's going through the pain. If you are not strong, you would break down. We've seen a couple of people whose marriages have been on the rock. A father brought the child to Kolebu, and once the child was there, I think that was the first time the child was diagnosed with sickle cell disease. That was the last time we saw of the father.
And he left?
He left and never returned. So I had to now forgo, even though my son was there, I had now to play the support for the other mother who had come in. And she had no idea why her child was going through it. So I'm happy that we are having this conversation. It's not easy, but it's stressful. And if we can, I always say that, look, it's not like cancer or hypertension or diabetes that is acquired. The child, through no fault of hers, is born with it. If we can, and at that time, like Doctor has explained to us, we assumed that the blood groupings was our genotype.
Yeah.
And so we mistakenly agree that, I'm negative and therefore, but when you do the electrophoresis, like Doctor has said, you get to know, and if you can, avoid it, especially if you have any of the sickling hemoglobins. Because what you are doing is that every time you decide to have a child, there's always a percentage of ensuring that 25% of having a child with a sickle cell. Yes.
Wow, ladies and gentlemen, so this is Good Living segment. Today's topic for discussion is sickle cell anemia. I have seated with me Rosalind, who has a child with sickle cell, and Dr. Sheila, who is a pediatrician from the sickle cell ward at the 37 Military Hospital. Rosalind will keep on talking about the story. Let me come to Doc briefly. Doc, the symptoms. Rosalind has mentioned swelling parts of the body, pain in the joints, and the temperature rising. What other symptoms are there?
So you see, Rosalind said that for her, the child's symptoms started coming at 6 months of age. And it's very typical with sickle cell disease patients because between the first 6 months, they have the baby hemoglobin, what we call the fetal hemoglobin. And the fetal hemoglobin is so healthy, it's so strong, it pulls oxygen to its cells, so it masks the symptoms of sickle cell. From 6 months, when the fetal hemoglobin has weaned off, then you start experiencing the symptoms. The first symptoms that they will usually see is the swelling of the hands and then the legs. Just as Rosalind said, you will be with your child, there's nothing wrong with the child will be crying, no amount of consolation will stop the crying. Definitely, this child is going through some discomfort, this child is going through some pain. And those who have experienced, studies have said that the sickle cell pain, I don't know how many women are listening to me who have gone through labor. They said the sickle cell pain is about 10 times that of labor pain. So you can imagine what the children go through. The other symptoms, you see that their eyes are yellow, what we call jaundice, because their red blood cells keep breaking down. So once they keep breaking down, their eyes becomes yellow, their urine color will change. Instead of the normal urine color being clear or straw, you see that the urine becomes like Coke, what we call Coca-Cola like urine. Your child will pass urine and you realize that the urine is looking like Coke, meaning that the red blood cells is breaking down. They are usually very pale. They have what we call frontal bulging. You see that their forehead is a bit protruding. It's up as compared to other normal children. Their teeth, what we call natopathy, you see when they close their mouth, you see that their teeth is also protruding because of the sickling phenomenon that is going on. Generally, they are smaller than their peers. They are stunted. So you compare sickle cell patients who is 3 years old to a child who is normal 3, you see that there's stunted growth. A lot of other symptoms. They can go through their acute crisis. All of a sudden, you realize that they have become pale. Their stomach has become big, abdominal distension. It has pulled all, the spleen has pulled all the blood to itself and they have become very pale. They can be there all of a sudden, have difficulty in breathing, they are coughing, they are having crisis with their chest, what we call the acute chest syndrome. They go through a lot. In fact, sickle cell affects all parts of the body. All organs are affected, from our head down to the toe. The liver, the kidney, the eyes, every organ suffers from the sickle cell.
One of the symptoms you mentioned was the protruding teeth.
Yeah.
Is it everybody with that could possibly be a carrier of sickle cell?
Not a carrier. The carriers don't show the symptoms.
Okay.
The carriers who are usually fine, they don't show any symptoms. It's those who have the disease. And there are various degrees of the natopathy. For some, it's so obvious. For some, it can be mild, moderate, severe. So depending on the degree of the natopathy, you can actually see the teeth coming out. But if it's very mild, it will only take the medical eye to see that this is a symptom.
So the probability of most people with such protruding teeth, of they being sickle cell, is high.
Yeah. With the other symptoms combined, with their frontal bulging, their stunted growth, their eyes being yellow. Yes, if you put all together.
Let's talk about how these symptoms come by in the stages of the growth. Do they come at once? How do these symptoms pop?
So there's no time specific for any particular symptoms.
Okay.
They can get, as the word is acute, they can get what we call acute crisis, and it's all of a sudden. It can, in the moment the child is playing, the next second The child,
like Rosalind mentioned.
The next second, the child will be crying. The next second, the child will be having difficulty in breathing. The next second, the child will be passing Coca-Cola-like urine. The next second, the child will be having high-grade fever because they are also prone to infection. So it's just ongoing. It just comes in as and when the crisis sets in. And it's all because of the sickle cells in the blood.
Rosalind, let's talk about your son. He growing up, going through all these changes, going through all these pain and all that. How were you able to let him know that this is what your body is going through? This is what you can do being with friends. This is what you can prevent. These are the things that you can do to prevent yourself from, you know, experiencing this and that. How are you able to educate him as to how to live?
Okay, so the first 4 years, I mean, you can't prevent the child because he is. And one of the advices I got was that don't let him feel that he is disabled.
Okay.
And so all we needed to do was to keep an eye on him and monitor him. But we made sure that anybody, especially his older siblings, he has 2 young older siblings, so we made sure that they were the ones who would be his eyes and ears, and that they would protect him and remind him, go and play, but there is a limit to which you could do, especially before he had the surgery.
Okay.
So we would allow him to play. You play.
As in the spleen surgery?
Yes.
Okay.
When you are tired, you rest. But one of the things that we ensured that he did right from the start was his ability to drink a lot of water.
Okay.
So you drink water to keep yourself hydrated. And so he would always come around with his water bottle and ensure that I need to take 3 of this, I need to do this. But then as he grew older, he understood it because currently he's been put on hydroxyurea. But before he was put on hydroxyurea, it was basically the normal, regular routine drugs, which is the folic acid and Zincovit and all that. And then when he was, he had undergone the surgery, he was also put on a Pen-V, which is an antibiotic. So what we do is that we let him digest bits at a time. Okay. Because when you try to put everything on him, you make him also become a little bit scared to live.
It becomes overwhelming.
Yes. So at every given time, we tell him, when the pain is severe, we try to explain to him why he's having those ones. I mean, he had real fits of septic arthritis. And if sickle cell pain is painful, septic arthritis is like double the sickle cell crisis. And so he ends up with all the swellings and everything, and he's not able to go to school. He doesn't. And so you wake up in the morning, you need to test the mood. For you to know that he has a problem, you have to test the mood. If he wakes up in his bubbly, usually self-hugging, good morning, then you know that everything is okay. If he wakes up and, how are you? Then he does this.
Then you know that there's something happening.
So it was a signal everybody got used to around him. But we have told him, and we are guiding and leading him, you don't need to overwhelm him with the information, but just give him enough to be able to live through the day. After he was put on the medication, I think that we've seen a lot. Doc will talk about it, I'm sure, but we've seen a lot of improvement. Look, the first 7 years of our lives, we always spent Christmas at the hospital. We've spent Christmas from age 2 to age 7. I think the 8th birthday. So on his 9th birthday, I remember, I never forget that, because he woke up at home and he said, what is today's date? And we said 24th. Then he just jumped out of bed. Yippee! For the first time, I'm not at Kolebu. And you could see the excitement. Yeah. And that is how we are helping him live through it. We are making him read and understand it, because now he's in JHS 2, so he is able to read and understand. So that is how we are gradually doing it. But every stage, we try to ensure that he can only take in as much as he should.
Okay. Well, unfortunately, we are pressed for time. But Doc, before you go, what are some of the preventive measures? How can this be prevented?
I think we've already spoken about the prevention, the screening before marriage, because if you screen,
which is the main thing.
That's the main thing, education and then screening. So you do the HB electrophoresis, know your genotype. Once both of you have these abnormal hemoglobin, don't go on. The love will vanish when the sickle cell children come. If you're not lucky, like hey, that all your 3 or 4 children become sickle cell patients and you don't have the resources, it's bad. But I would like to emphasize on the hydroxyurea.
Okay.
Hydroxyurea has come, it's available. The good news is even on the National Health Insurance Scheme.
Nice. And
the hydroxyurea has come to give sickle cell patients peace and their parents. It's actually helped by producing more of the baby hemoglobin that I spoke about earlier, the fetal hemoglobin. So it prevents them from getting all those frequent acute crises. So those on hydroxyurea it's been a testimony. There are no more coming to hospital, reduced hospitalizations. They are now able to go to school. Their pain crisis is once in a while, like every month that they're experiencing it. So we encourage parents to enroll on the hydroxyurea program because that has come to help. One will ask what are the side effects. Yes, paracetamol, every drug has side effects.
Okay.
That is why we monitor you closely when you're on hydroxyurea. And even being at the sickle cell clinic, those on hydroxyurea, I can't think on top of my head which of the side effects that has come about, apart from maybe darkening of the nails. But even that, when the dose is reduced, it comes back to normal.
Okay.
So the benefits of hydroxyurea far exceeds the side effects that you think of and the complications that they go through as far as the sickle cell is concerned. You're thinking of the side effects, not enrolling on the hydroxyurea, your child experiencing frequent crisis, frequent hospitalization, affecting your work, affecting his education, affecting the other siblings in the house. There's nothing that can be compared to the teas.
The real threat of having a child stroke.
And then children also do get stroke with sickle cell disease. You can imagine a 4-year-old, a 5-year-old with stroke. Even when adults get stroke, it's a burden.
Yeah.
How much more having a child with a stroke? Once you enroll in the hydroxyurea, your chances of getting this complication of sickle cell is minimal.
Well, Dr. Sheila, thank you very much. Rosalind, thank you very much for sharing your story with us. Before we go, let me read a few messages. This one says, I'm really learning from this discussion, very educative. Kindly be adding your names to the messages that you send so we can acknowledge you with the messages. Good morning, this is Joel. Please, I would like to know if there is a prominent symptom or sign shown by people with sickle cell condition. Next one, we have, this is very educative because we've been battling this disease for a year and sometimes we lose hope. Now he's 32 years but experiences erection of his male organ for about 4 hours without going down. We took him to Confanoche. It's so horrible. We need more education. You didn't add your name. I really wish that we had enough time. But briefly, Doc, can you briefly speak on this?
So one of the common complications of sickle cell patient is what we call priapism. And priapism is sustained painful erection.
Wow. So
they will be there and they will have an erection so sustained, so painful. It is not aroused by seeing a woman or anything. It's just a complication of sickle cell. So it's one of their crises that they go through. And as I said, the hydroxyurea has come to reduce all these crises because when they keep having the sustained painful erection as a complication of the sickle cell, it can lead to infertility. So immediately when they get that adequate hydration, pain medication, sometimes you can do cold compress on the penis, and you immediately have to run to the nearby hospital for the necessary intervention to be done. It shouldn't stay more than 4 hours. Once it has started, within 15-20 minutes, you should seek help. Because if you leave it, it can lead to infertility.
Okay, all right. Doc, thank you once more. Let me read 2 more messages and then we are done. My name is Jennifer. I've been with this guy for 7 years now. We are about to get married, but they said we are not compatible to get married. Okay, Jennifer. It's important that you get tested before you commit yourselves in marriage. And let me read the very last message. Hi, I'm Rita from Volta, Agbozume. Thank you so much for this program. My son's own started from 4 years and now he's 9 years. Thanks so much for the lesson. We are elated that you have learned a lot in relation to sickle cell anemia. And so thank you for being with us right here on Prime Morning. And it's time for us to end this segment. My guests have been Dr. Sheila Asamoah Oshoe, who is a pediatrician at the Sickle Cell Clinic at 37 Military Hospital, and Rosalind Amo, who is a mother to a sickle cell patient. Ladies, thank you very much for your time and have a lovely morning.